Your feet may be warning you about diabetes right now, and you may not even know it. Not your blood test, not your doctor's office, your feet. Because long before many people are officially diagnosed, the body often starts sending signals. Quiet ones, easy to dismiss, easy to blame on age, poor circulation, dry skin, or tired legs. But those small changes can mean much more than that. Today, I want to show you 9 warning signs in your feet that should never be ignored. And for each one, I'll explain what people usually assume it is, what may really be happening inside the body, and one simple habit that may help protect you. My name is Dr. Michael Harris, and one of the most dangerous things I see is not just diabetes itself, it's undiagnosed diabetes. People living with high blood sugar for months or even years, while their nerves, circulation, kidneys, and skin are slowly being affected. And often, the very first place it shows up is the feet. So let's start with sign number 1. 1. Tingling or numbness. If your feet often feel numb, prickly, or like pins and needles, do not brush that off too quickly. Yes, sometimes a foot falls asleep if you sit the wrong way, but when it keeps happening without a clear reason, that can be different. High blood sugar can slowly damage the outer covering of nerves. When that happens, the signals traveling from your brain to your feet become distorted. That tingling sensation is not random. It may be your nerves struggling. One of the best daily habits here is simple. Walk every day. Even 20 to 30 minutes of walking can help support blood flow to the feet and keep those nerves better nourished. 2. Burning feet at night. This is one many people find especially upsetting. They get into bed, the house is quiet, and suddenly their feet feel hot, burning, or irritated. A lot of people blame the weather or fatigue, but burning feet at night can be an early sign that nerves are misfiring. In other words, the brain is receiving a heat message even though nothing hot is touching the foot. That can happen when nerves are irritated by chronically elevated blood sugar. A helpful habit here: drink enough water during the day and add more fiber to meals. Vegetables, beans, oats, and other high fiber foods can help support steadier blood sugar levels. 3. Cuts or blisters that heal slowly. This one is no longer just uncomfortable. It can become dangerous. A small cut, a blister from a shoe, a cracked spot on the heel. Normally, these should improve. But when blood sugar stays high, circulation can worsen and healing slows down. That means oxygen, nutrients, and immune support do not reach the wound as efficiently. So what looks like a small problem may stay open much longer than it should. Tonight, after your shower, take 30 seconds and inspect your feet. Look at the heels, the soles, and between the toes. If you notice any wound that is not improving, do not ignore it. 4. Darker, reddish, or bluish skin. If the skin on your feet or around your ankles starts looking darker, redder, or even slightly bluish, pay attention. This can happen when circulation becomes poor and the tissues are not getting the fresh, oxygen-rich blood they need. Many people think it is just aging skin or discoloration. Sometimes it is, but sometimes it is a visible sign that blood flow is being compromised. A simple daily habit that helps: ankle circles, toe raises, and calf stretches for just 5 minutes each morning. Small movement can help wake up circulation. 5. Very dry, cracked heels. Now let's talk about cracked heels. Yes, dry skin is common, but if your heels are deeply cracked, hard to heal, or stay dry no matter what cream you use, there may be more going on. Diabetes can affect the nerves that control sweating and moisture in the skin. When those nerves do not work properly, the feet can lose their natural moisture from the inside out. That makes the skin more likely to crack, and those cracks are not just cosmetic, they can become entry points for infection. A good daily habit here: moisturize your heels and soles every night, but never put lotion between the toes, because trapped moisture there can cause fungal problems. 6. Swollen feet or ankles. If your socks leave deep marks, or your feet and ankles seem puffy by the end of the day, take note. Swelling can happen for many reasons, but persistent swelling may be a sign that the kidneys are under stress or that circulation is becoming inefficient. And the kidneys are one of the organs high blood sugar can affect over time. When fluid is not being managed well, it often settles in the lowest part of the body, the feet and ankles. A helpful habit: when resting, elevate your feet slightly and reduce heavily processed, salty foods when possible. 7. Sharp, stabbing, or electric-like foot pain. Some people do not get numbness first, they get pain. Not just soreness, but sudden stabbing, electric or needle-like pain in the feet, often worse at night. This kind of pain is easy to confuse with arthritis, overuse, or an old injury, but sometimes it is nerve pain, and that matters because nerve pain needs attention. Simply covering it up again and again without knowing the cause can delay the real problem. Before getting out of bed each morning, spend a few minutes gently stretching your feet and ankles. That small routine may help get circulation moving before you put weight on them. 8. Feet that are always cold. Some people have naturally cooler feet. That happens. But if your feet are cold all the time, even in warm weather, even under blankets, that can be a sign of poor circulation. When blood vessels narrow or stiffen, warm blood has a harder time reaching the feet. And since the feet are the farthest point from the heart, they often show this problem early. One of the best habits here is a brisk daily walk. Not necessarily intense, just consistent. Movement helps push blood into the lower legs and feet. 9. Less hair on the feet or lower legs. This is the sign almost nobody notices. If the hair on the tops of your feet or lower legs has become much thinner or disappeared altogether, that may reflect reduced blood flow. Hair follicles need oxygen and nutrients just like every other tissue. When circulation is poor for a long time, hair growth may fade. It seems minor. But sometimes it is one more clue that the blood vessels are not delivering what they should. So after this video, look at your lower legs and feet. You may notice something you have overlooked for years. Now let me say something very clearly. Not every one of these signs means you have diabetes. But if you have several of them, especially numbness, burning, slow healing, discoloration, swelling, or persistent pain, that is your signal to take action. Do not guess, do not wait, do not assume it is just age. Check your blood sugar, talk to your doctor, and tonight, take 1 minute to really look at your feet. Because catching a problem early can change everything. The earlier high blood sugar is recognized, the more you may be able to protect your nerves, your circulation, your kidneys, your mobility, and your independence. So please, look at your feet tonight. If they are trying to tell you something, listen.